Welcome back to CBS Mornings. We showed you earlier how President Biden is pushing for all Americans to be vaccinated against COVID. He and other vaccine advocates face a lot of opposition in many parts of the country. Political tensions are spilling over into healthcare, and there are cases of hospital workers coming under attack. Jonathan Vigliotti visited a COVID ward in Idaho, where only about half of the eligible population is fully vaccinated. He saw firsthand how doctors are struggling.
We have now had to convert day surgery to a fourth intensive care unit space.
ICU Director Dr. Megan McInerney is normally the last person you want to meet at St. Alphonsus Hospital's growing COVID ward.
If you're sick enough with COVID to meet me, your chances of dying are pretty high.
About 50% of patients who have been intubated in recent months have died.
There are vaccines available to prevent the very scene before our eyes, and yet here we are.
Yes, right. It did not have to be this way.
Hey, Alicia, how's it going today?
McInerney's colleague, Dr. Carolyn McFarland, says misinformation and political division over vaccines have become an unexpected and deadly side effect of Idaho's COVID crisis.
The divisiveness that we saw with politics, I'm seeing that same kind of trend in healthcare, and that alarms me, that I'm treating patients for their political views, whereas this virus does not care.
In Idaho, it's not required and even frowned upon to wear masks indoors. Many don't.
I thought this would be bringing America together to fight a common evil.
As more sick residents flood hospitals, some medical staffers are leaving. St. Alphonsus has lost 50% of its entire staff since COVID began, mostly due to burnout.
We do often get family members berating us up one side and down the other.
Charge nurse Alicia Luciani has had enough. Today is her last day in the ward.
What's going on in your mind right now?
There's just so many of them. I have put more people in body bags over the last 2 years than I have in the last 9. It's hard. And there's just a heaviness. So, that, in an effort to preserve my own mental and emotional health, was helped with the decision to do something a little different.
The exhausting and polarized climate has also led to troubling protest signs like this one outside the ER, calling doctors murderers.
I feel for all of us who are trying to fight against COVID and provide care, and that's what the greeting is.
Now, more than 18 months into a pandemic that once celebrated these workers as heroes, Dr. Megan McInerney says today she thinks twice about wearing her scrubs in public.
Is it because I feel unsafe? I don't necessarily think so, but I'm certainly not going to put myself out there. I'm not going to, put up the sign that I'm a healthcare worker.
Once celebrated as heroes, today some at times feel like the enemy. One RN in this ICU actually left to become a checkout clerk at the local Walmart. She said the stress, the long hours, and the frustration simply became too much, Gayle.
Boy, Jonathan, it's a heartbreaking story because all the medical people want to do is save our lives. And I'm wondering how they're coping and what they tell themselves to keep going when it seems their work may not be appreciated because of politics. Makes no sense to me.
Yeah, it makes no sense to me, too. These are incredibly strong people. A few minutes into each of our interviews, all of them at points started to cry. The hope that they do have comes from the lives that they do save. There are so many people in the overflowing COVID wards here. When one person gets out, they jump around here in this ICU to celebrate those small victories to get through it all.
Yeah, they should please know a lot of people appreciate the work they do, and we need them desperately. Jonathan, we thank you.